Welcome back to Capitol Tonight. John Hawkins is the Senior Vice President for Public Policy for the Texas Hospital Association. We're glad you're here. I know you're looking ahead to the next session here next month.
Yep.
And so let's just get straight to Medicaid expansion. Is Medicaid expansion the top priority for the Hospital Association going into the year?
It actually is. Of course, we would like to do something a little bit different than straight Medicaid expansion. What we'd like the legislature to do is actually use the leverage the Supreme Court has given us by making it optional. Use that leverage to create a Texas-specific solution to address the uninsured, the working poor in this state.
Yeah, as a matter of fact, I mean, this campaign, the Texas Way, and there's a website specifically about this plan. Describe how it works and maybe what it's based off of, too, because there are other states that have come up with their own unique ways to draw down those Medicaid dollars.
Yeah, we really have an example of other states with conservative leadership that have used this as an opportunity to create not straight entitlement expansion, but rather private market solution, get a waiver from the federal government to use the federal funds that have already been allocated to us to actually create a private market solution that has personal responsibility, that creates better health outcomes for Texans.
Yeah, give us an example of how that might work, and how, if you're talking to a lawmaker, for example, who may be on the fence on this because there is concern that, hey, we're worried about the Medicaid system in general, where it's headed in the future. Why go ahead and propose this now, and why you think it would work?
Well, basically what we want to do is rather than give folks an entitlement, actually give them subsidy to purchase insurance in the private market. That has the advantage of training them how to use insurance. You can create health savings accounts, which will actually create better health outcomes. There's cost sharing, so the client will actually make better decisions about the utilization of health care. So really the market-based alternative is better than what was originally anticipated under Obamacare.
And this plan also talks about myths that you feel are out there that you want to maybe explain so people aren't concerned about it. For example, that the federal government may renege on its offer of covering 90% of the cost. Talk about that or any other myths that you want to clear up.
Yeah, well, first of all is the financing piece. I mean, we recognize that the federal budget situation is a concern. People need to know that the ACA was financed. A lot of it was through cuts to providers. So we've been taking those cuts for the last couple of years. The coverage expansion can help providers offset that. Additionally, if the feds do change the rules of the game, we can put a sunset date in this that says we'll walk away from the table, just like we do on other decisions, because we're a balanced budget state.
And not drawing down these dollars, remind us of how the Texas Hospital Association sees the impact in terms of the amount of people who are not covered and how that affects health care here.
Yeah, so we've got about a million Texans that are working poor, basically. They're part of the Texas miracle, the economic miracle. They have jobs. They just have jobs that are at a low enough wage where either their employer doesn't provide coverage or they can't purchase insurance in the private market. So these are folks we really need to cover because they're creating about $5.5 billion in uncompensated care every year that's getting shifted on to local taxpayers and onto the private insurance market.
Do you get a sense from the new leadership coming in with Governor-elect Abbott, for example, initially during the campaign he was saying, we want a block grant. This would be not exactly a block grant, it would be a waiver where you have your own plan. But recently he's kind of indicated that, well, let's wait and see. We do need to see what happens with the courts in terms of the funding, the Supreme Court and funding of provision of Obamacare. What's your sense politically on this?
Well, again, I think most folks recognize it's not good for Texas to lead the nation in the number of uninsured. So they would very much like to find a solution. However, they don't want to do entitlement expansion. They want some flexibility for Texas, and I think that's appropriate. We would argue that this is actually a good chance to pilot a block grant. If we could get this right, then we could make the case to the federal government for a larger block grant of the Medicaid program.
On other topics here, I know in the last session there were cuts that affected hospitals, and THA is very mindful of that heading into this session. Can you tell us what the impact of last session was to hospitals and what you're hoping lawmakers do this session?
Yeah, again, I think across the healthcare sector, particularly in the Medicaid program, the rates that are paid to providers, physicians, and hospitals particularly are an issue, because if we don't create an adequate network of care, again, that just creates more uncompensated care, which is higher cost to the taxpayer. So definitely rates in Medicaid are important. Workforce issues, making sure we have enough doctors, nurses, and other allied health professionals to actually provide these services are important as well.
Being a very diverse state, we have a lot of rural healthcare providers out there. Is that still an issue in terms of trying to get doctors, nurses in these areas to provide care?
Absolutely. When you look particularly at what's going on in the oil and gas sector, those folks a lot of times are relying on those rural hospitals if there's an on-the-job accident, if there's transportation accidents out in rural areas. So it is very important that we keep those rural hospitals operating and that they have the appropriate healthcare professionals to actually be able to provide services on site.
Is there anything that you propose or hope that the legislature may do to address this issue?
Yeah, I think again, funding for graduate medical education is very important, and where we can prioritize that or provide incentives for folks to actually practice in rural areas is always helpful as well. So loan repayment is a way we've done that in the past. But legislature put some money in graduate medical education last session. We hope we can build on that this session, and that's good economically for this state. Lastly,
I know there's many issues that you try to tackle this session, but is there another one that we haven't discussed that is also critical for THA heading into this 84th session?
Yeah, I think again, another thing we look at is our trauma system, and we've got a funding stream, the Driver Responsibility Program, that provides funds for trauma centers in the state, and we hope we'll keep that program going, and that the legislature actually appropriates that money to those trauma hospitals.
Okay. John Hawkins is the Senior Vice President for Public Policy for the Texas Hospital Association. Good to visit with you. Thanks for being with us.
Thanks for having me.
And we'll be back with more Capital Tonight right after this.